Hi, I'm Susan Taylor with Scripps Health in San Diego, California. Until recently, treating cancer involved surgery, chemotherapy, and radiation. But there is an emerging targeted therapy approach called Theranostics, which is showing promise and is much more precise. Joining us to talk about this is Dr. Nikunj Patel, a radiologist with the Scripps Cancer Center in La Jolla, California. Doctor, thanks so much for being with us.
Thank you for having me.
So go into a little bit more detail. What is Theranostics?
Theranostics is a combination of two terms, therapeutics and diagnostics. What we do is inject a liquid into your arm, and that circulates in the body and targets the cancer cells. We first use a lower radiation to identify those cancer cells, and then we use a higher radiation dose to actually target those cells and kill the cells.
You call this the medical smart bomb, is that right?
We call it medical smart bomb because we're not affecting all the cells in the body, just the ones that are the cancer cells.
So, how is this different from chemo and radiation?
So it's actually a form of radiation, but it's a specific radiation where we're not targeting the whole body or an organ. We're actually targeting the actual individual cancer cell within your body and inside the blood.
And so, do you use the theranostics in addition to chemotherapy and radiation or instead of it?
So you would actually use this in replacement of the chemotherapy and radiation therapy. This is really a specific therapy for people with advanced cancer that can circulate in the body and target multiple areas simultaneously.
And what cancers is this used to treat?
So this is used to treat two types of cancers right now: pancreatic cancer since 2018 and prostate cancer since 2022.
And the incidence of prostate cancer has really been on the rise, hasn't it?
It has. In fact, American Cancer Society just released an article showing that there's been a 3% increase in prostate cancer incidence every year for the last decade. And more of them are actually advanced prostate cancer has been increasing by 5%. So more of the cancer is actually being identified at a more advanced stage.
So, how precise is it?
Actually, with this theranostics, it's very precise. It actually identifies specifically a target on the cancer cell itself.
And so, you can really personalize the treatment for each patient?
Exactly. We can individualize it for each patient and adjust the dosing for each patient accordingly.
So, is this just one session, or do you go back for multiple sessions like you would for chemotherapy and radiation?
So this actually is like the other treatments, requires multiple sessions. It needs 6 sessions, and they're given 6 weeks apart.
And what are the benefits of this theranostics?
The benefits of this theranostic agent is that it's very specific and targeting only the cancer cells and not affecting the healthy normal cells that are adjacent to it.
So, it doesn't destroy or affect the surrounding tissue or the organs.
No, it's actually goes a very short distance, only, millimeters at the maximum in distance.
And you can see actually in real time how effective this is in killing the cancer cells.
We actually are able to then image the patient on this machine and then identify how many more cells are left that we need to treat.
So, is this something that you would use after trying chemo and radiation?
So this is actually one of the benefits of this agent now. It was initially only approved to be used after patients had had chemotherapy, but now it is approved to be used prior to patients receiving chemotherapy. Because it is so specific and targeting the cancer cells and is so well tolerated by patients, they now have approved it to be used prior to chemotherapy.
Are there any side effects to theranostics, and is there any downtime to the treatment?
That is one of the better things with this form of treatment. The actual side effects are very few typically. Patients experience some fatigue. We do have to monitor their blood work, and the fatigue may last up to a week typically. Some patients may get some GI symptoms vaguely, and specifically with the prostate cancer patients, when we do this treatment, they may experience some dry mouth. But overall, it's a treatment that's very well tolerated. And in fact, that's the reason why it was moved up to be used prior to chemotherapy.
So, the bottom line is that it is way more precise, it is more effective, and it is less toxic.
That's correct. It is a very specific treatment, targeting the cancer cells specifically and making sure to not normal cells are not affected by it. It is able to do it with often significantly less side effects compared to chemotherapy. And overall, patients have been tolerating these treatments very well.
How do you know that you are a candidate for this Theranostics, for this medical smart bomb?
So this agent is used primarily in the advanced stage of cancers. That means it has spread outside of the prostate gland or the pancreatic gland and is in other organs or elsewhere in the body. If the cancer is localized to just the prostate or the pancreas, then there are other therapies that may be used prior to this therapy.
Any final thoughts, doctor?
Yes, these therapies for the right patients that have advanced cancers are very well tolerated, very easy to administer, and more importantly, we can use this technology to actually see where the cancer cells are in the body and what's left to be treated. It's a very specific therapy that really is going to change how we treat cancer in the future.
Doctor, thanks so much for being with us. We appreciate you taking the time.
Thank you.
If you want more information on treating cancer with Theranostics, just click on the link or go to scripps.org/videos. Want more critical information about your health? Please subscribe to our Scripps Health YouTube channel and follow us on social media at Scripps Health. At Scripps, we're here for good. I'm Susan Taylor. Thanks for joining us.